Hey everyone, welcome back to my channel. Kelly here. I am a physical therapist and I specialize in cancer rehab and lymphedema. There are a lot of different claims and controversies out there on the internet, but also still between providers or healthcare professionals about lymphedema after breast cancer surgery. Some of these are really outdated, some of them are true, but how do we know? So today in this video, I'm going to talk about 3 different questions or myths about lymphedema in relation to breast cancer or breast cancer surgery and talk about what is true or what is not. This video is going to be a part of a series of videos, so if you want to see the other videos come out, be sure to subscribe down below. And if you want to see more content related to cancer rehab or lymphedema, you can also follow along with us on Instagram. And if you have any other questions or myths that you want to hear more about, you can also comment those down below. So the first myth or question is, does getting blood draws or getting scratched on the side or the arm that the lymph nodes were removed cause lymphedema? So we're really just jumping into one of the biggest controversies that still exist. For many years, it was recommended that someone should not get blood drawn on the side or the arm that they had lymph nodes removed. Now, there are more recent studies that show that there is no correlation between getting your blood drawn and getting lymphedema, that this does not cause this. Now, the question is, why was this being said? Why was it being recommended? There has been no proof that it does cause this, so where is this coming from? The reason why someone suggests or recommends not to get your blood drawn on the side that you had lymph nodes removed, or really not getting scratches or cuts as well, is simply because there is a correlation between any opening in your skin and infection risk. Anytime we create any opening in the skin of any sort, we really are increasing risk for infection. Yes, everyone has had blood draws or cuts sometime in their life, and most likely they have never had an infection from it. However, the thought process is if you've had lymph nodes removed or you have a dysfunction now of the lymphatic system, which plays a role in the immune health, if you get a cut or a scratch or an infection, your immune system and your lymphatic system have to work extra hard to help process this to heal. And so if it's backed up or it's not working correctly, the thought is that there is a risk that it will exacerbate the lymphedema, that it will back up the lymphatics further. Again, these recent studies, which I will link in the description down below, show that there is no cause or correlation with this. But although there is no support to say that yes, there is a cause here or someone is at a higher risk if they get blood drawn on that side, it is pretty easy to be ultra conservative and just have your blood drawn on the other side or the other arm. Now, along with this, another recommendation that is common to hear is don't garden. So again, it's not that the gardening causes lymphedema, it's that someone is trying to recommend to avoid getting cuts or scratches like from thorns. And so if we're being conservative, it would be wear gloves while you garden, something protective, but someone is going to get some sort of cut or scratch at some point in their life, likely on this arm. And so what do? You just want to clean it well, put some antibiotic cream or some sort of ointment on it to keep it clean, cover it, and just watch for any infection signs. Risk is, again, not immediate, but there is a little bit of one, so we want to just be aware of that. So is the overall question, does getting blood draws cause lymphedema? No, it does not cause it. We are just looking more at the infection risk. Anything we can do to do small things to lower infection risk, that would be ideal. There is one study that looked at 30 different lifestyle factors and if there is a correlation or cause of lymphedema with them. And the only thing that was found to have a correlation with increased risk for lymphedema was the use of a sauna. Again, I will link that study down below that someone can look into and read into further. So let's go into the next question or myth. Does vigorous exercise cause or increase the risk of getting lymphedema? Now, this is a recommendation that was used for many years to help decrease the risk of getting lymphedema. However, this one has been completely debunked. There have been a lot of new literature and research coming out to show that not only is exercise safe after breast cancer surgery, it can also help decrease or lower someone's risk of developing lymphedema. There's a really well-known study out there called the PAL study. This study worked with women who were 1 to 5 years out of their breast cancer surgery, and they had a group that did weightlifting for 1 year. And so they had supervised weightlifting with an instructor for about 3 months, and the other 9 months that they were doing on their own. And they compared this group who was doing the weightlifting with a group that did no exercise. And what they found was that 11% of the women in the group who did the weightlifting developed lymphedema, while 17% developed lymphedema in the group that did no exercise. And now on top of that, if the women had more than 5 lymph nodes removed with an axillary dissection, the risk and the changes in the proportion were even greater. And so with those who did the exercise or the weightlifting, 7% developed lymphedema, while 22% of the non-exercise group developed lymphedema. And so you can see that not only is it safe to do, but it can also help lower the overall risk of developing lymphedema. We just recommend that someone starts low and slow. If we think about a lot of muscle soreness or a lot of muscle strain, what is happening when someone gets soreness? Well, it is inflammation or swelling of a muscle. And so we're not trying to make someone really sore when we're exercising. So we want to start low, light weights, and gradually build up to avoid that. But overall, there is no limitations to what kind or type of exercise someone can do. I'm always a big advocate of someone finding something that they enjoy to do. And if we can just build up into that, we're doing it safely. But overall, there's an improved quality of life and a reduced risk of developing the lymphedema. We know that the muscles act as a pump to the lymphatic system. So if we do activities, whether it is weightlifting or maybe it's something else like jogging or swimming, whatever that is that someone enjoys, that can help get things moving through the lymphatics and really make sure that we're keeping that area healthy. Now, if someone has lymphedema and they're wondering about exercise while they have it, we do recommend that they wear their compression sleeve while exercising if able, because if we add that compression with the muscle pump inside, that's really going to be optimal to keep the lymphatic system pumping and moving. And the last question or myth that we're going to talk about in this video is, does sleeping on your side or wearing a bra after a mastectomy increase the risk of lymphedema? Generally, this one is false, but there is a little slight bit of truth to this one in a certain way, which we'll talk about. Sleeping on your side after surgery isn't going to cut off the lymphatics. Yes, after surgery, someone may wake up sore or tender in the area because they put pressure on it and someone is still healing. That's not going to damage the lymphatics, someone is just causing some more inflammation. Now, similar thing when we're talking about a bra. There is a lot of recommendations not to wear a bra with underwire or certain types of bras in general. And when we're thinking about that is really more for comfort. If someone has restriction or a tourniquet from the underwire, we may see a little inflammation or swelling around that. Is that going to cause full-blown lymphedema of the whole area? Likely not, but they can have some localized pockets of swelling if they are really tourniqueting in that region. And so we talk a lot about good bras to use, which I've talked about other videos. AnaOno has a wonderful range of bras. This one is the most popular one, called the Roller bra. It's really soft, it's really thin, it doesn't have a lot of restrictions, there's no wiring to it, and the band at the bottom is not overly tight and tourniqueting. It can be adjusted in the front for comfort, and the inserts or the paddings come outer in depending on what type of surgery someone's had. If someone has swelling and we're looking to bring it down, they talk a lot about compression bras, which people think about a sports bra. But again, a sports bra may have a really tight band on it, which can cause restriction and some more inflammation. And if someone has swelling or lymphedema, it can restrict that. And so this type of bra is a true compression bra. This one's from PrairieWear. And what it does, it has full coverage. It doesn't have a special or thickened band at the bottom, so it's not tourniqueting. It has nice full coverage on the sides and comes up high, so it's not tourniqueting nice and low. If someone wears a bra that's low on the band, some people will swell above it. And so we're looking for the right amount of stretch, the right type of fabric. But again, what we're thinking about with types of bras, not that any of them are going to cause lymphedema, but they can increase swelling if we are causing too much of a tourniquet. But no, wearing a really restrictive or underwire bra isn't going to cause full-blown lymphedema by itself. So overall, we're just thinking about comfort when it comes to certain positions. When we think about something that may make someone swell, it's not necessarily lymphedema. It could just also be that inflammatory response or that healing process. If you want to hear more about these different types of bras that we recommend, I have created another video on the best bras after surgery, which I will link up above and in the description down below, as well as I will link some of these options I spoke about down below in the description as well. And so those are the 3 myths or questions that we're talking about today. Again, I am creating other videos on other myths related to lymphedema and breast cancer surgery. So if you're interested in learning more, be sure to subscribe down below and feel free to comment down below about any other myths or questions that you might have for future videos. I hope you all have a wonderful week, and I will see you all next week for another video. Thanks, everyone.